In this video, we discuss insulin potentiated chemotherapy, or IPT. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. IPT is promoted as a way to make cancer more sensitive to chemotherapy, so less can be used. Unfortunately, the evidence supporting IPT is scant. There are cell line studies that show insulin does increase the cancer-killing power of several chemotherapies. An animal study also showed that insulin concurrent with the chemotherapy, doxorubicin, decreased tumor burden 61% more than doxorubicin alone. Some early trials with the ketogenic diet during cancer treatment also relied on insulin injections. See our ketogenic diet videos. Yet insulin itself has been found to be tumor-promoting in several cancer lines. For instance, one study examined the effects of insulin on 49 cancer cell lines and found that insulin increased cancer growth in 47% of the lines, decreased it in 14%, and the rest had no significant change. The cancer cell lines in which insulin induced the most growth were ovarian, 123%, lung, 37%, and colon, 28%. There have been two proposed mechanisms for the supposed potentiation of chemotherapy by insulin. Insulin has been suggested to increase the permeability of the cell membrane for cytotoxic drugs, resulting in higher intracellular drug concentrations. Another hypothesis is that insulin increases the number of cells in the stage of division with active DNA replication, making the tumor more vulnerable to chemotherapy agents that target certain stages of cell division. There are only 2 human trials examining IPT in the scientific literature. One study in 16 men with metastatic, castration-resistant prostate cancer found that IPT led to median survival of 11.6 months, while standard of care treatment would predict a 18.9-month survival. It may be hard, however, to draw a direct comparison since the independent functioning of the men used in the IPT group seemed to be fairly low. In a randomized controlled trial, 30 stage 4 breast cancer patients who were resistant to hormone therapy and the chemotherapy drugs fluorouracil, adriamycin, and cyclophosphamide were separated into 3 groups of 10. One group received a low dose of methotrexate, a chemotherapy drug, and insulin. Another group received just low-dose methotrexate, and the third group received just insulin. After 8 weeks and 2 cycles of treatment, the insulin and methotrexate group had 9 patients with stable disease and 1 with progressive disease. The methotrexate group alone had 3 patients with stable disease and 7 with progressive disease. The insulin alone group had 2 patients with stable disease and 8 with progressive disease. Group 1, insulin plus methotrexate. Group 2, methotrexate. Group 3, insulin. Group 1 has far more stable disease and less progressive disease than either Group 2 or 3. Although this breast cancer study is encouraging, the fact that there are so few human studies and insulin can exert such variable effects in different cancer types should put doubts in the minds of most people. For more information about insulin potentiated chemotherapy, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.